It's like exercise, okay? You do it once, it's good for you, but you're not going to get any lasting effects if not done on a regular basis over a period of time. The same way when you take medication, you take this antibiotic every 7 hours for the next 7 days. That's the protocol. Okay. So with chiropractic adjustments, depending on what the condition is, how bad it is, the age of the patient, of course, there are many different factors. Okay. Right. But the typical protocol would be maybe you'd have to see that chiropractor twice a week for a 2-3 week period until the changes become more stable, and then they can maintain it on their own. Okay. So it's a process that you work with. And if we go back to working out, if I wanted to strengthen this muscle, I would do a set of exercises targeted for my biceps. I would do that at least twice a week, and I would do it for 3 weeks. After that, I'd have a base level of strength there, and I don't necessarily have to focus on it so much anymore, and I can just maintain that on my own every so often. Initially, I might have needed help from a professional. Now I'm good. Right. Something like that. Okay. And also, it's like going to a dentist. Okay. You go to a dentist, get some extensive dental work done, whatever it is. Okay. You leave the dental office and you don't floss, you don't brush your teeth, you eat sugar, blah, 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 blah. Of course, you're going to have to go back. With going to a chiropractor, the equivalent of that is heat and stretching. Okay. The more you heat up your back, the more you stretch it out, the more you take care of it, the more you avoid certain things that are bad for it, the less you'll have, the less chances for you having to go back and see him. So, yes and no. It's not something you have to do forever and ever if you're doing the right things for it. And just because the conditions that we treat are so varied. I mean, think about it. Your muscular system is over 65% of your whole body. Right. You could get problems from your toe to the top of your head. Your joints are all over. You have knee joints, toe joints, ankle joints, shoulder joints, elbow joints. So the chances of you developing an injury that falls within the scope of practice of a chiropractor is quite high. So it's not that you have to keep going back over and over again. It's that you're seeing a chiropractor for many different conditions that are affecting a large organ system.